Now, the Civil Society of Malaria Control, Immunization and Nutrition is calling for a more gender-focused balance in malaria intervention across the country. They want this done through the empowerment of both men and women with the right knowledge without leaving any gender behind. This formed the crux of the quarterly advocacy on the progress of malaria response in Nigeria. Kemi Balogun has more on the story.
241 million cases of malaria were recorded in 2020, compared to a lower figure of 227 million cases in 2019. This is according to the latest World Malaria Report. To mitigate the effects of this life-threatening disease on the population, there is a need to continually review strategies to eliminate it. This is why this national network of civil society organizations working on the prevention, treatment and mitigation of the impact of malaria is reviewing mechanisms towards ensuring that malaria is eliminated. One of the issues at this quarterly meeting is to ensure that women are involved in malaria interventions at all levels. This, they believe, can be done through the identification of gender-related barriers that exist in their coverage areas and take steps to mitigate their effects.
You go through all the data and information. The women are more affected in all parameters of malaria. Each of us know from experience that when we were ill with malaria as children, or even in our homes now, it is the mothers who are the primary caregivers. So women are more affected.
You have a great role to play. We believe you have been doing this, like he has mentioned, it is on remark. He said this is the 4th edition.
Gender imbalance affects malaria intervention, and this group wants to encourage methods that will enhance women's participation in order to reduce the 627,000 annual deaths that occur due to malaria disease.
Our allocation keep increasing from $890 million US plus COVID interventions, 246 million. And when we have this grant, it came with little conditions. One of the conditions for malaria intervention for the country, Nigeria government, to make sure that they make provisions for SPs for pregnant women so that they can get the 3 courses of IPT.
This might just mean that we are changing the way we do things, because from the national level here, we have all the policies. It's usually at the primary health care, the local government and community levels that the operationalization of those policies are mangled up. We should emphasize education, information sharing, to go alongside treatment. And the education that we are talking about is the one that is a two-way thing.
About half of the world's population is said to be at risk of malaria, with the most vulnerable groups being pregnant women and children below the age of 5.